Welcome. My name is Robert Tasker, and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. Lots of great content in the July issue, and I just want to go over my 3 editors' choices and what I've placed in the PCCM Connections category. The first article follows a sort of feast study-like definition. The paper comes from Malawi. Bensman is the first author. They've looked at 54 children with a severe febrile illness and assessed left ventricular dysfunction in this population. There's a great editorial about multimodal monitoring, and also have a look at the meta-analysis on left ventricular systolic function in sepsis that was published last year in PCCM. The second study comes from Uganda and Kenya in 30 children. First author, Obonyo. Again, this is using feast study type severity of illness criteria. And the authors have looked at the use of continuous infusion of fluid therapy at 4 mils per kilo per hour without the use of bolus dosing. So there's an interesting editorial that goes with this. So again, worth reading. And the third article is by Teller and colleagues at Boston Children's Hospital. They have brought together a cohort of 232 congenital diaphragmatic hernia patients and looked at the prevalence of supraventricular tachycardia and the treatments they have used. I think this is a good reference paper. We all come across this problem, so just remember where to find it in PCCM. In the PCCM connections, I focused on epidemiology this time. I will be writing something about epidemiology sometime this year, but take it as it is. The first study is from the FIS database, 2014 to 2019, looking at PICU volume, ICU practice, and invasive procedures. They seem to be diminishing. The second and third article to do with epidemiology comes from the VPS data set. The first is 2009 to 2018 and looks at early post-operative extubation in CICU patients. And we will have more on this topic later this year. And the other VPS article looks at COVID-19 related school closure and a new metric which the authors call standardized admission ratio. So well worth looking at the figures in this report. And then finally, 2 papers to do with ARDS, neonatal ARDS in 15 centers around the world, and PARDS trajectory in 8 centers in the USA. So altogether, a great read, lots of things to look at. If you need more details, go to the website and just download my Editor's Choice PDF, which is free, and I'll see you next month. Great. Bye.